Everyone who are gathered here. On this auspicious event, I would like to welcome you all to the 4 days of International Virtual Workshop on Research Methodology and Writing Skills, jointly organized by Lavender Literary Club, Cap Comedian Trust, and Malaysia Industrial Relations and Human Resource Association, Malaysia. Today we have two speakers and also a moderator. First speaker, Dr. Sheetal Sood, Associate Professor of Special Education, Chair Department of Education and Director of Online Education Programs, University of Hartford, USA. And the second speaker of today's session, Dr. Tilaga Jagya, Assistant Professor, Department of Education, University of Hartford, USA. And the moderator of today's event, Dr. C.I. Rajesh, Head of the Department of English, St. Alfonso College of Arts and Science, Kanyakumari District, Tamil Nadu. It's our immense pleasure to invite Dr. C.A. Rajesh to introduce the speakers. Over to you, sir.
Good evening to all present in this 4-day International Virtual Conference on Research Methodology and Writing Skills, organized by Lavender Literary Club, jointly organized by Cap Comedian Trust and Malaysian Industrial Relations. As being a part of Lavender Literary Club, I'm really happy that they organize a lot of programs that's useful for both staff and the student community, and particularly they focus on research writing and based on it. Today they have organized such a wonderful thing on research methodology and writing skills, and we have two guest speakers. Two are from Hartford University. One is Dr. Sheetal. So, ma'am, am I right in pronouncing your name?
Yes, perfect.
It's Sheetal Sood, right?
That's correct, yes.
Yeah, okay. Dr. Sheetal Sood and Dr. Tilaga Jagya. First, we have as the first session, we have Dr. Sheetal Sood, who's the chair of Department of Education and Director of Online Education, and she's an Associate Professor of Special Education at the University of Hartford, where she teaches both graduate and undergraduate students on elementary education and special education. To be in such a position, she has to work hard. That means she had worked hard in the future days. She has come up with a lot of research publications, research articles. Moreover, she has done a lot of research in how to educate the elementary students. Without such an experience, she couldn't be in such a height. We are really proud of you, ma'am, that you are on this platform today. You have accepted our invitation. You have been on time, and thank you, ma'am. Now I ask all the participants to keenly listen to ma'am's words of experience, and at the end of the session, please go ahead, shoot your questions, your doubts, and your opinions, so we all could learn, till the end of till the deathbed. All are learners, so we have to learn a lot. As Robert Frost said, miles to go before I sleep, miles to go before I sleep. As a learner, we have to travel miles and miles. I'm happy to be as a moderator. I welcome you, ma'am.
Thank you so much, and thank you for the opportunity to be a part of this presentation. Just to give you a little background, just to add to the introduction a little more, I am actually originally from India. I grew up in East India, originally from North India. So I basically did my undergrad and my grad program there in political science and international relations. And at that point in time, I got interested in special ed and came to the US for a master's degree in special ed, and just completed my doctoral program. And then I've been at the University of Hartford since 2009, which really gave me the opportunity to get to know the schools around us and, of course, to be able to develop programs as well. So it's been a fascinating journey. And of course, I learned a lot because things were different. I mean, when I came to the US in 2001, India was very, very different. And I try and go back every year, especially over summer, to spend time with family. And just, it's amazing to see the change that's happening there. But once again, thank you, and I welcome this opportunity. So what I wanted to do today was wanted to present on a topic which was new to me when I came here. And it's a topic on single subject research designs. Because every time when I thought about research, I would think about having either a large data set, lots of numbers, or it would be, what do you say? Basically like math and statistics, which would usually kind of scare people away. And then I was introduced to the topic of single subject designs. Can everybody see my screen?
Yes, ma'am.
Perfect, thank you. Today we'll spend some time on talking about the different ways in which you can actually work with a small group of students and still get meaningful results, be that reflective practitioner who's always kind of changing things that they're doing, how they're thinking of things and so forth. And even then it is considered to be an experimental design. So like I said, I just found it very fascinating, and I wanted to share some of my experiences with single subject design. Now I won't say that all of my research is in single subject design. Most of it actually is in group designs because my work happens in an elementary classroom usually. But because of the special ed focus, I've always had a few students who needed that extra support and extra push, and how we were able to use single subject design. Another very fascinating thing about single subject design was when I was introduced to it, it was basically all kind of focused on behaviors, like how to change behaviors. It was, I learned about it through the lens of applied behavior analysis, where you were focused on the student or the individual and you wanted to change something, and you were basically focusing on that behavior, putting an intervention in place and trying to change that. Over my time here, when I got involved in my research, which was mostly in math because I wanted to make math less scary for school students, and STEAM education, and I was doing group designs, I was like, why cannot we use single subject designs to work with small group of subjects and be able to see those changes? So the whole objective of today's presentation is to kind of familiarize you with the single subject experimental design. I'm sure some of you probably know about it, probably more than I do even. So it's more about my experiences and how I understand it. And I'm going to provide you some research examples. So in the sense, I'll just share different models of single subject design and then kind of connect it to a research study, research studies that have used the single subject design and how they've presented the data. And also want to point to the fact that single subject designs can actually be conducted in academic settings. And in fact, they use a number of professions like psychology, social work, medicine. So it's quite fascinating. So just to begin with, in a nutshell, what is experimental design? So experimental design, just to keep it very, very simple, is when there is a problem, you have a question, and you're trying to figure out what is the cause, what can you do to fill that gap so that the problem doesn't exist anymore, and what implications would it have in the future. So oftentimes you find yourself trying things, and the things that you're trying are basically your intervention. And then you sit down, you've collected data, and if you take a simple example like, suppose there is a car and it's making a sound, you are looking at it, you're trying to figure out where the sound is coming from, you are observing, you are like trying to really like touch and see if where the sound is coming from, and you kind of pinpoint where it's coming from. There's a loose end and you kind of tighten that, and that in itself is a kind of your intervention. You do it a couple of times and then you figure yes, that is actually the problem. So what you've done is you had a problem, you came up with a hypothesis, you basically tested and tried different things that prevented the problem from occurring, and you came to a conclusion. You probably would take it a step further and say, these were the few things that I tried, and then you would analyze the data and you would come to a solid conclusion. And being a reflective practitioner, what you would do is you would actually think about the future and what you could do better. So a quick nutshell of experimental designs. So let's talk about the types of experimental design. There are two: group designs and single subject experimental design. Like I mentioned, group designs were the ones that had more prevalence because you could do more complicated statistics. You could probably collect data a little faster. You would have to, however, work with a large group of students, usually more than 12. And you would hopefully have two groups. One was the control group and an experimental group. You would implement your intervention with the experimental group and compare the results to the control group. And when you are assigning participants to groups, if you're allowed to, you would do a random selection. So a number of steps, and the fact that it usually requires more students to get a high effect size or a higher impact, it does get very time consuming, and it takes that individual piece out of the research. Now, if you're interested in really understanding or working with individuals and trying to kind of individualize instruction and intervention for them, you could use a single subject experimental design. For a single subject, you could actually have anywhere between 1 and I would say up to 10 participants. And it really depends on how you group them or how you are collecting data. It is an experimental design because the participant itself serves as their own control group. So that's why you don't need another group of participants to serve as the control. Another advantage is, well, like I've already said, a small group, and you can simply manipulate the variables that you are measuring to figure out the impact of the independent variable on the dependent variable. So basically, the impact of the intervention on either the behavior or the skill that you are trying to change. Once again, easy to implement, a little more time consuming than a group design, but it does give you the data that you need, and it also allows you to make the modifications as required. So helps you really, really individualize it. Any questions so far?
Ma'am,
Yes.
can you please give any other example apart from math subject?
Apart from?
Math subject.
Yes, so my examples, I'll give you a lot of examples from behavior.
In literature, because I am doing my research on literature, so it will be more clear if you explain like that.
Absolutely.
Okay.
I will. You'll see examples in a little bit from around the subject areas.
Okay.
Yeah, absolutely. So single subject design play an important role in evidence-based practices. It's a very important resource in clinical practice. So clinical practice meaning anything that involves working in the field, whether it's with students, whether doctors are working in the field. It really helps you collect the data and pinpoint the problem. And like I said, a huge advantage is that you can individualize it. There are tons of names for single subject design. It's also called the time series design, within subject, a small n, single case, experimental and behaviors, and the single subject repeated measures design. The single subject repeated measures design, when combined with another model that I will show you, is the one that kind of works the best. But time series design is nothing but, when you're doing a pre-test, intervention, post-test, maybe following it by a delayed post-test. So you are repeating your assessment a number of times. Between subjects is when you have a group, a sample, and then you take that sample, say you have 10 students, and you divide it into two groups. One group gets treatment A or intervention A. The second group gets intervention B, and you compare the results and then see what the results are and what the impact has been. Within subject is when the whole group gets the one treatment followed by the second treatment, and then you see the kind of impact that had on the students. And like I said, I'll give you examples, and this will kind of put it all together for you. But just remember, if you're reading research, single subject design does have multiple names, but it's basically talking about the same thing. So types of single subject design. Once again, a number of ways. The one big disadvantage of single subject design is external validity. You do have to rely on replicating the study because it's a small group of students. But the very basic single subject design is an A-B design, where A is the baseline and B is the intervention. And basically what's happening is you are going in, you are observing a behavior, or you're observing a student completing, say, something in writing, like over time, a number of times, and you have, say, given them a writing prompt, and the number of sentences they are being able to write are just 2 or 3. And then you have a stable baseline, which would be A, and then the line in the middle would actually be the intervention. And that at that point in time, so in this case, after the 5th interval, they put the intervention in place. And they found that in this graph, they were reviewing arguments and comments. So they put an intervention in place where they wanted the arguments and rude comments to reduce. And they saw a huge change or a drop in the number of times the student was arguing with another individual. So once again, you're observing the behavior first at baseline without any intervention in place. You make a decision based on the data as to what exactly is needed. You put that intervention in place, you implement it, and you measure results to see what happens. The big disadvantage of this is that history cannot be ruled out. So once you've taught the skill and then you stop the intervention, chances are the behaviors might come back. So it gets a little challenging. And because it only has one intervention that you're measuring against basically one set of baseline data, it's not the most reliable. But once again, simple to implement. If as an instructor, as a mentor, you're looking for something quick to measure and change, this would be the way to go. So what is it really looking for? The research question in this case is, does outcome X change the baseline levels from when the intervention is implemented? So once again, you have the baseline, you have the intervention, you collect data, and you figure out next steps. Advantage is, like I said, quick and efficient. very low stake, right? You can do this in your own time. It could be a very simple intervention you've put in place. It could be that could be a student needs a writing prompt as opposed to just a topic. It could be as simple as you're giving them some sort of reinforcement if it's a behavior, and that positive reinforcement is kind of bringing the behaviors down. What it doesn't do is it doesn't count or address internal validity. So you can't always say that it was only the intervention that impacted the change. So in that sense, it's not a true experimental design. We would call it almost like a quasi-experimental design. Now, to overcome that, there were other single subject designs that were put in place. And another big one was withdrawal designs. Now, withdrawal designs are, you can do them in two ways. One is an ABA format and one is an ABAB format. And I will tell you exactly what that means in a minute. But what basically happens is with these designs, you can control the impact and the history. However, it might have a carryover effect, because if you've taught an individual something, you can't really take that away, especially if it's a skill and not something tangible. If you're not giving them something, you won't be able to take it away. And researchers do consider sometimes for this to be a little not ethical, especially when an intervention is working and you kind of withdraw it just to test the impact. So once again, looking at the graphs, A is the baseline, B would be the intervention, A would be the baseline again, and B would be back to intervention. So in this case, anxiety was being measured and during class time. So without any intervention, the levels of anxiety were high. When an intervention was put in place, the anxiety kind of went down. When the intervention was stopped or withdrawn or concluded, the anxiety went up, and then intervention was placed back in, anxiety levels came down. And it basically indicates that there was something about the intervention that was working. Like I said, it's considered not to be very ethical only because you are now, after phase A, you're taking away something that's working, and you are kind of almost forcing the student to get anxious. So that's when this gets a little tricky to implement. So just looking at another research study, in this case, it was focused on vocalization while the students were using a picture exchange communication system. So this was a group of school students with autism, and they were having a few problems with vocalization. So they weren't really being as vocal as their instructors or mentors wanted them to be. So what they did was they collected baseline data where no positive reinforcement was provided. And you will see the number of times the students vocalized or made a comment, or there was one student who was jotting down notes. The number of times the vocalizations happened were very close to zero. And then they started positively reinforcing the students. The vocalizations went up. They withdrew the treatment or intervention. It came down. And then once again, it came up when vocalizations were brought back. So vocalization, what the ABAB design here said, that yes, positive reinforcement really helped this student to vocalize what they were learning, or it kind of, you can even call, think about vocalization as engagement. So student was a little more engaged in what they were learning. They were a little more motivated to learn just because a teacher or a mentor was providing them with the positive reinforcement. So And now let's talk about, to make it a little more reliable, the data that we collect. And in those terms, what we use is a multiple baseline or probe design data. Multiple baselines can be concurrent or they can be non-concurrent. And it basically happens in 3 series. You could be collecting data across participants, skills, or settings. And you basically start data collection on all 3, whatever you select, whether you select 3 participants and you want to measure a skill across the participants, or if you measure a target problem or a skill that you want them to learn and you measure it across 3 skills, or you look at 3 different settings. The length, it does get a little long to collect data when it comes to multiple baseline, but what it really does is control for history, and it really checks on internal validity. And just to give you a visual on how that works, and I'll come back to the non-current, but this is a visual of multiple baseline design across anxiety, so across a skill. So this here in this case, it's anxiety, but it could be a skill that you're trying to teach a student. So for when I did one of my studies, it was actually focused on reading comprehension. And we were trying to see how many questions students came up with in a given amount of time for a particular text that they were reading. And we collected multiple baseline data. So for first participant, you start collecting baseline data. When you see a stable baseline, you put the intervention in place and you start continuing intervention data for the first student. When you start the intervention for the first student, you will not be starting the intervention for the second student at the same time. Their baseline will be an extended baseline. Once you see the first student being successful and you see a stable data collection, you implement the intervention for the second student. And then for the third student, the baseline is extended even more, and you wait for the second student to get stable, and then you implement your intervention. So what it does, it allows you to basically use, in this case, client B and C as control group for client A, and client C as a control group for client B. So within a very simple model, you have been able to kind of measure and control data. Now, once again, the baseline is starting at the same time for all. So data collection is starting at the same time. However, the intervention is staggered based on how students are doing. In terms of the non-current baseline design, the researchers decide on the length of the baseline, and as they find more participants, they add them to the studies and place them in random groups. So it's not as structured as the concurrent baseline, but what it allows for is you are not missing out on anybody just because they were not available when you started your study. An advantage of multiple baseline is that you are not required to withdraw an intervention that was working. So it makes it ethical, and it requires, it's very appropriate for behaviors that are non-reversible. Now, if you've taught students, say, a spelling, you can't really take that skill away from them. So that's where it gets a little tricky in terms of what design you use. A disadvantage is that you need multiple individuals, or you need multiple responses, or you might need multiple settings and skills that you would be testing the data on. So another study on that used multiple baseline design was across participants, and here they were examining collateral language effects of a question asking training. Once again, because single subject came to the forefront, mostly because of applied behavior analysis, which is a very famous intervention to use, or reliable intervention to use for kids with autism. This study also included participants that had autism. And in this case, they were measuring the number of unprompted questions that the student asked. As you'll see at baseline for all three, it was like the data was 0. They weren't really asking any questions at all. An intervention was put in place, and you will see that there was a huge jump for all three participants, and they maintained it, especially the first and the last third student, you will notice, really maintained it. With the second student, we see a little up and down, but it's kind of still at an upward trend when they stopped. I mean, obviously, when I look at this, I say they should have collected a little more data on the second child before they implemented or bought the intervention for the third, because for me, the last 3 points on the second child's data are not really stable. But those are the conclusions that you can make by looking at a simple graph. So you're not sitting there with tons of numbers, calculators, statistical softwares trying to figure out what's next. You can simply look at a graph and you can make some of those decisions. A multiple treatment design is very, I won't say it's similar to the multiple baseline design, but basically what you're doing is you are testing a number of different interventions. So in this case, what they were doing was the number of calls that were made and the responses over weeks. When there was no outreach, the number of calls was still high. But what they noticed was, so what about? Without outreach, we're here. We'll send out notices. The data results were still the same. So notices weren't working. So they said, okay, media ads. And they saw a little up and down, but still it wasn't the best thing to do. So the best thing that worked here was meetings. And that's why they concluded that for this particular group of students and or individuals, we have to reach out to them, but not through notices or media ads. Having direct meetings is the best way to go. So once again, very simple visual analysis of data tells you about an intervention that worked. So for multiple treatment, it can be extended. You can mix and match a number of variables. You can do a component analysis. But once again, you have to be careful about the types of behaviors that are being observed. Once again, when I say behaviors, please know that they can be skills that you're teaching individuals as well. And yes, it can be time consuming. The other big disadvantage is you never know if the increase by the time it came to meetings was a result of a combination of number of things. Maybe the individuals liked the notices and the meetings, and that's why there was an increase. In this case, I would say it was probably a kind of combination between media ads and meetings, because you see an upward trend in the media ads before they switch to the meeting model. Here is an example of a multiple treatment design used for communication skills again. And so a lot of things going on. So there were 3 skills that they were measuring. And the packet that they were using, what they did was they took an entire packet and implemented it at the first time. The treatment packet included functional communication skills, plus a prompting strategy, plus timeout. And after they had collected data on that, they kind of split it into the 3 different components. And they did functional communication, they did their prompting, and they did their timeout. And in the middle, you'll notice they implemented the treatment package, the treatment as a package as well. So they went from a package to functional communication only, came back to the package, came back to your timeout, and then they came back to the package. Once again, took quite some time to collect the data, but it was something that was simple. They were able to do it within the class during the school time and make some decisions that help these students with the challenging behaviors that they were having. Alternate treatments, once again, very similar, but what you're basically doing is you are taking a treatment and you're alternating them. Very similar to what I just described here when I said they took the entire packet, they altered it with one component, went back to the packet, came back to one component, went back to another packet. So once again, it involves rapid alteration, which means you as a person who is implementing the intervention needs to be prepared to be able to rapidly make changes to the intervention, observe what's going on, and making sure that it is helping the students. Tons of advantages and disadvantages. The advantages being it can be extended to and compared to a number of interventions. So you're not just waiting for a student to fail before you make a change. If something's not working, you can step in and you can make a change. Once again, it gets tricky with behaviors that students can learn and keep. What you have to remember, it does provide a strong experimental evidence within a few sessions. So it has its own advantages, and like nothing comes with the disadvantages. So you just have to figure out what is best and how to kind of balance it out. Another example of alternating treatment design, and in this case, it was for a student who was making inappropriate sounds. And what they basically did was they kind of did not do an intervention here. If challenges are, sorry, they didn't do a baseline here. If challenges are really severe, you don't have to do a collect baseline data just because you want to prove something. You can actually start implementing the intervention and then just kind of collect data to see what is working. And that's exactly what they did here. And that's why you don't have the baseline phase. But you do see how the intervention that was put in place kind of kept behaviors in a stable, almost a stable format, but the number of responses in English and the tongue clicks were kind of are at a positive, show a positive trend. So like something is working. So just a few quick points. It's a single subject design, a great tool for practitioners. It definitely shows, helps you evaluate the impact of the intervention. It has 3 components: repeated measures, which allows you to control your design a little more. It has your baseline phase and treatment phase. It is a disadvantage is it is susceptible to the effect of history, but depending on the model you use, you can really minimize that. It is, one thing you have to be careful about single subject design is you have to make sure that your data is stable before you move from one phase to the other. And what research has shown is that at least 3 stable data points. So if you want something where the student is, say, using a particular strategy of, say, chunking words and spelling them right, you want to make sure you have at least 3 data points before you decide whether or not the intervention is working. Most research, like I said, because it has its roots in behaviors, a number of researchers have used it to measure behaviors, but like I said, they have used it for the level of functioning as well. Data analysis is not as complicated, and I will show you a few strategies in terms of how you can use quantitative data, and it doesn't always have to be just a visual inspection. For generalizing, as you know, in education, you want students to be able to generalize a skill that you are teaching. So if you are teaching them how to write in a writing class, you want them to be able to take that skill into, say, a science class and be able to write there. So that once again gets a little tricky, but it can be controlled for through systematic and direct replication of the study. So once again, very simple. Maybe you worked with a small group of students. You found that this particular strategy worked with this group. Would you be able to take that strategy and implement it with another small group of students who might benefit from it? So just one more example connecting it to research, and in this time around, it was a study which was looking at the effects of peer-assisted sentence combining instruction on writing performance of young writers. And so for this study, they worked with 4 fourth grade students who were identified with a learning disability, and they basically taught them how to construct and compose sentences. It was conducted at an inner city elementary school, and all 4 students had writing difficulties. So their learning disabilities was basically focused on challenges with writing. The intervention in this case was implemented 35 minutes a week for 3 times a week. So 35 minutes, 3 times a week is when the intervention was happening. The intervention was divided into 3 units of instruction, and each unit of instruction had 6 lessons. So they completed their study after the implementation of 18 lessons. So they took a skill, they took 2 skills, and they kind of divided it into 3 separate units. So they chunked the intervention. And what they did was implemented 6 lessons each to keep it consistent, and we'll see what the results were. So what they did was they used the multiple baseline across subjects design, and they were basically, the treatment was students' writing performance. So they were basically trying to measure that. And at the baseline, what they did was they just asked students to write stories, and that was based on skills that they already had. There was nothing that else was given to them. They were just asked to write a few stories, and then they implemented the treatment that focused on story quality, and then there was a post-treatment the post-test where students wrote 3 stories again. And what they were able to basically was compare the post-test to the baseline writing that their students had done, and determine whether or not the intervention had an impact on student performance. So here is the data. In this case, what they did was they are doing multiple baseline across groups of students. So they're not just have one student, but they divided the 4 students that they had into 2 groups, and they compared. So for story quality, we see for Zeb and Jenna, at baseline, the quality of the work was pretty low. It was between 1 to 2. For Jenna, you will see it was a little inconsistent, but for Zeb, it was pretty consistent at a score of 1. And then they implemented the intervention, and we see a positive trend. The second group of students had a very consistent baseline, like both students, very consistent in terms of quality, and intervention was put in place, and you see an increase in the quality of work. So once again, something here tells us that the intervention did work for these groups of students. For the same group of students, they also measured sentence construction and combining. And once again, it's very similar results because the skills kind of go hand in hand. Very similar results, lower scores. For Zeb and Jenna, the increase in trend after post-treatment definitely is higher. Whereas for Sam and Nancy, they seemed to struggle a little, but if we would continue collecting data, they were moving towards a positive trend as well. When we look at the first graph in figure 6 for Jenna, once again, I would have probably collected at least 1 or 2 more data points to see if that positive trend would be coming back, or was the 6th day just not a good day? Like something definitely happened on the 6th day. And that's when you bring in the anecdotal notes to say what was going on with Zeb on the 6th day that we saw a drop in scores. So those are the questions you want to ask when you are trying to analyze the data when it comes to single subject designs. So how are results presented? So how do you write this all up? You would use visual representation, which would basically look at levels. It would look at trends. It would look at how much time did it take for a student to get used to the intervention. However, at the same time, you can collect quantitative methods. Yes, you won't be doing any sophisticated statistics, but there are ways of collecting quantitative data based on single subject design. And one way of doing that is looking at percentage of non-overlapping data. And for basically what you're doing is you're once again looking at your graph, you're drawing a line from the highest point in the baseline through intervention, and you are basically counting everything that happened above that line. So in this case, you will say 8 out of 12 treatments had a positive impact. And then you would just apply this formula, which is number of intervention data points exceeding the highest baseline data points, divided by the total number of data points in the intervention phase. And you will come up with a percentage. And the score for PND ranges from 0 to 100%. And higher the number, the more effective the treatment was. Percentage of exceeding the median. In this case, you take the median, you draw a line, and you determine the impact that had on the treatment. So once again, it could be from 0 to 1. And in this case, 100%, right? So there was something definitely working with the treatment. So it was a very effective treatment in this case. And then another method, and this is actually one of the more reliable methods, would be to calculate the improvement rate or difference. There are a few steps involved, but basically it is the improvement rate which you calculate by first calculating the improved data points and divided by the number of total data points. So just to give you an example, you are basically going the number of improved points minus the total number of improved points during baseline. So IRD is the total improvement rate difference. IRT is improved rate during treatment. You're determining that number. You are determining the IRB, which is improvement rate during baseline. You are subtracting IRB from IRT, and the percentage that you get shows you the effect size of that particular treatment. Once again, higher the number, the better the effect of the treatment. All right, so that was just, of course, there are a whole bunch of other models that can be followed, but I wanted to be respectful of time, and I'll open it up to questions. Any questions you have for me?
Chirashmita Bhattacharya, you have raised your hand. Do you have any questions? Chirashmita Bhattacharya, I hope no one is into it. I'm really, it was a wonderful one. And your presentation shows that you have involved a lot into it. Actually, the most important aspect in research is that involvement. Involvement into what you do. You love what you do. That's what actually you have said us. The main clear message that in this presentation or in this day you've given us is that a great involvement where most of them present from the from the text context, but you have come up with from your experience. Really, we are blessed to listen such a thing in from your presentation and education, especially on single subject design. Because in India, classrooms are run group where we have from 30, 40. When you go for colleges, we have even 70 students.
Yeah.
A mass number. And you were telling about single subject design, which is more popular in most of the foreign countries. When you go for Japanese education, we have 1+5. We come a single subject design. The same method comes over there too. Okay, anyway, it was a good thing. I loved certain things coming into this, that you were saying functional communication that is needed in research. That's what nowadays the people, they don't have. They don't have a functional communication. Even they don't communicate with the fellow researcher.
Yep.
They don't communicate with the seniors. They don't communicate with the experienced. They don't communicate. That was the term that really I loved it when you said about functional communication. It's more essential. And you were telling about repeated measurement. Today, research is nothing but researching, going on digging it. Some that is digged earlier. We don't actually reassure what we do.
Yep.
We go ahead with something and we don't reassure it. We just get what we have, because most of the papers that are published with a particular result becomes a failure after 2 or 3 measurements.
Yep.
That's what is happening in the present research world. Your words of repeated measurement, that was wonderful. That's what we need in research. Actually, we need repeated measurements. And you are telling about baseline, that what we don't do. Actually, we all go to the heights. We don't go on the baseline. What we are doing. Actually, everything is in our base, than the heights, like an iceberg. It's what we can see here. And even that was a good one, ma'am, the baseline and data analysis. Data analysis, most of the people do. What is data analysis? But you had a peculiar way in data analysis. Anyway, it was a good presentation, ma'am. It was a blessing for us, and thank you for spending your time, valuable time.
No, thank you. And what I can tell you from experience is I do come back to India every year, and I'm working with a group of teachers for professional development. And when I introduced single subject design to them, they were a little skeptical because they had never thought of it that way. But it really has worked out, because I continue working with them even now via online modes, even when I'm in the US. And I have received very positive results from those teachers who have used this model. So if there's anyone here who wants to use it, you need more information, please feel free to reach out. My name is there my email is on the presentation. So don't hesitate to reach out at any point in time.
Sure, ma'am. Sure. I put my words to the audience. This is a wonderful opportunity to shoot questions. Questioning improves you. If you are a good researcher, you'll have a lot of questions. If you're into it, your questions will be valuable. Please, it's your turn.
Can I ask questions?
Sure, sir.
Yeah. How, Dr. Sital? I'm Professor Bala from Malaysia. Sorry, I have several meetings today. But I have one question. I think a lot of people in this room struggling which method to choose, especially the postgraduate student, even some other young lecturers don't know what method. They always go to the method rather than finding the clearly a research problem statement and also research problem. That is the big problem, to identify the gap in the theory, and then they go only talk about, oh, I want to do quantitative. They're like they think that quantitative is something like, easy. Okay, fine. That they say qualitative very tough. So, what is your, based on your experimental design? Because I feel that what is your advice to them that method not come first? Actually, method come later. Actually, the research problem very fundamental issue. I think I'm examining thesis PhD for many PhD theses. And also locally, and also I'm supervising the student. Especially the one young lecturers after PhD still struggling. They don't know what to do. So, what is your advice? Just briefly advise to all of us here where to start. Is it method come first or the problem come first? Which one first? And how they're struggling to choose. Some say quantitative very easy. You do say. I mean, of course, you need PLS and all these. The method is actually techniques, not really. So it's like trend. Trend. The fashion. Everybody go PLS. Everybody go there. What is that? That is a meaning for research. There's a meaning for the policy. There's a meaning for the important for them. Or they want to give PhD. That's all. I'm doctor. But after that, don't know what to do. So that is my my worry now at this moment. It becomes like fashion and trend. And then after that, you know what to do next. So, Doctor, please, what is advice? Maybe you have they're doing. I know USA fundamentally they are very strong on the quantitative. I know that. Of course, people are going to qualitative. Okay, thank you, Doctor.
Absolutely. So actually, most of my work is almost like mixed methods, where I do have your statistical analysis, but I also combine it with qualitative because I feel that gives you well-rounded data. My advice would be, and I will be honest, I learned it the hard way, is to use the backwards design. Think about the outcome first. So as soon as you've identified a topic you're interested in, you start reading the literature. At that point, and you've kind of identified a gap, at that point in time, start thinking about what outcome do you want. Once you figure out what outcome you want, it will help you not only design the intervention, but also help you identifying what method to use. It will basically also tell you, should I be doing a large study? Can I do it with a small group of people? I always recommend, try and pilot it with a small group of students to see the effectiveness, and then see if you can replicate it. I mean, as you know, in the academia world, publications are huge. I mean, that's one outcome you want for yourself. And maybe that pilot could be one publication and then your larger study. So my recommendation would be always think about the outcome first. As soon as you've identified a gap, think about 5 steps ahead. What results do you want from your intervention? What do you want the group of people you are working with to know? Or how do you want them to act if it's in terms of behavior? How do you want them to communicate? And once you know that, move backwards to figure out, okay, so what are some skills that will get them there? And then figure out, okay, how would I be collecting data? I think the whole data collection method or what design to use is one of the most interesting parts of research, because that's when you get down to sit with what you really believe in, something you're interested in, and you try and kind of almost manipulate to see how you can show that, yes, your intervention was effective and was helpful. So that's what my advice would be, to look at determine the outcome first and then kind of move backwards. I know it's challenging sometimes because we have that set in our mind that we're doing things in a particular order, but try and get out of that habit, because you will notice that suddenly the work you're doing will become more meaningful, because you will be more engaged and motivated to complete it, because you can almost have that, light at the end of the tunnel, because you know exactly where you want to go. You have that target. I hope this helped, Dr. Balakrishnan.
Yeah, okay, Doctor. Thank you very much.
Thank you.
Thank you, sir. Any questions, please? Please come forward with your questions. I hope all are tired because it's evening, right? After the hectic job, they are back and they'll be tired. And they are shy sometimes. Most of the people are shy. Because as being the learned people, they feel shy to shoot questions. Anyway.
Absolutely. Now, and if anybody wants to, if it's easier, you want to email a question to me, feel free to send me questions, not a problem at all. If you have a study in mind and you're trying to figure out what next, I will be more than happy to kind of help you and give you ideas with that as well. So reach out with anything.
Okay, ma'am. Thank you for being with us and spending your valuable time.